Hi, myself Dr. Pooja Bansal, consultant gynecologist at Nerul, Navi Mumbai. Today we are going to talk about induction of labor, a very commonly done procedure for the woman who is not getting the labor pain by itself. So what do you mean by induction of labor? Induction of labor means I am trying to cause labor to a full-term woman without the natural pains occurring. That means in a condition where you have already crossed your due date, that means your 40 plus week. So somewhere between 40 to 42 weeks of gestation, we try to induce a woman who is low risk and has not got their pain naturally. Now certain medical conditions, like including if you're diabetic, if you're hypertensive, if you have babies with IUGR, that means the baby is not growing inside well, we try to deliver and let them grow outside. If we have less fluid, it itself indicates there's something wrong inside. Movements has reduced. If we have cholestasis of pregnancy and certain other medical conditions which may land up a doctor to decide that we will cause induction of labor around between 37 to 38 weeks of gestation. Now, when we are causing induction of labor or when we are doing induction of labor, what do you expect to be happening? We try to induce labor pain with the help of certain mechanical procedure or the drugs. So what are the mechanical procedure? On the OPD basis, generally when the woman is coming to a term, I do something called as cervical swapping. That means we try to stimulate the cervix with the finger to cause the prostaglandins, which are the hormones responsible for the natural labor pain to occur. And most of the women will come in labor within few weeks. The other method could be when you're in labor or the labor, we want labor pains to increase or we want the labor to progress faster. We do artificial rupture of membranes. That means we burst the membranes and let the fluid drain off so the labor starts to progress faster. Very uncommonly done procedure could be that the ballooning of the cervical canal can be done with the catheter to expand or release the prostaglandin. It's not very commonly done procedure. Now after we have decided that we are not going in labor or certain medical condition, we need to cause the induction of labor. There could be the medicines which are very good for induction of labor. Those are called prostaglandins. So in the form of gel or a tablet or a pessary, we try to induce labor, and this has a waiting period. Like if I have given you those drugs, maybe I'll wait for a few hours, maybe 6 hours to watch for the pain to start and then assess the labor. Sometimes double induction is also needed. Once it is not working, we try doing it second time. Now, another drug which is very commonly used is oxytocin. That is also very good for induction of labor in the cases where most of the time the woman has come with the leaking, or if we want to augment the labor, that means I want to increase the labor pain and start faster in the labor process, I will use this drug. Now, if I am doing the induction, I'm doing the induction to have a vaginal birthing. But what could be the complications? The complications could be that, of course, there could be no induction at all, no pain at all. That means there's, whatever we try to give drugs, we try to give mechanical dilatation, but still nothing works and we definitely land up with the C-section. So that's called failure of induction. Second could be that we got a lot of pain, like hyperactivity. Too much pain can also give rise to the fetal distress and land up with the C-section. So beside these common things, not very harsh complications are observed for induction of labor. It's a very commonly used procedure for the woman who has certain medical disorder and needs to deliver on an urgent basis, or somebody who has crossed the gestational age and should not be waited for a long time. Thank you so much.